Well, hello and welcome to all of our viewers around the world. I'm Fiona Lang-Sharp, IBCLC Director of Communications and MC here at Gold Learning. Well, today I have the absolute pleasure of talking to Rebecca Feldman, who has been with us here at Gold before, and I'm so excited and grateful that you've been able to take the time to come back and talk about this important topic. And before we get into that, I will remind everyone as we get excited for this event and we sort of pouring over all the material, interviewing all of our amazing speakers, I want you to take time to head over to the website. So you can pause this right now, head over there, check out all the details at goldmidwifery.com. There is so much information and it will give you an opportunity just to check out all the time zones, know when you can join us live, which is what I always hope to see you there live, of course. But if you're busy too, all of the event, of course, will be recorded for your convenience. So lots of things happening and some really fabulous topics. I know it's going to take your practice again to a whole new level. So welcome to you, Rebecca. It's so good to have you here today.
Thank you. It's great to be here.
Yeah, absolutely. And as I was talking about this event, I mean, for you and I, we'd love to get together with our colleagues and professionals anytime that we can share, on these topics. And the topic that you're going to be talking about is when care isn't there. The lack of access to mental health services is costing mothers' lives. Now, this is a big topic. You and I have had a chance a little bit to talk offline about
Mhm.
how the depth of this the disparaging, data that there is on it. I know it's not going to be easy for a lot of people to hear this, but the value behind what you have to say in the messaging is it's important. I mean, and beyond that, it's a necessity, I feel, as
Mhm.
we move into this new year, things need to shift, right?
Yes, absolutely. And I'm so grateful to Gold Midwifery and Gold Learning to give this topic the platform that it really deserves. What I'm really looking to bring to the audience is to really understand now that we've expanded the data collection, not just in the United States, but in so many countries, that suicide and overdose are unfortunately the most common cause of maternal mortality in most of the high income countries that we have this data available for. I also want to honor all of the other countries in the world who have such high maternal mortality rates. So, like you said, it's a very hard topic, but one that we can make change happen.
Yeah, absolutely. And I think, when you say that statistic out loud, people are still very surprised. I
Yes.
share on it as well. It's almost shocking, like unbelievable. How could that even be possible? But it is true and fact. And so I know you'll be getting into that a little bit
Mhm.
more. I want to talk a little bit about you for a moment, Rebecca, because I recognize that, this is sort of, become your area of, expertise and some of your life's work. But tell me, you've worked many years in both maternity care, reproductive psychiatry. Can you share a little bit about what first led you to focus in on perinatal mental health and what you've seen that has made this issue feel so urgent now?
Oh, thank you. Yeah, so I was a labor and delivery nurse and a nurse midwife for about a dozen years. Absolutely loved that work and recognized that mental health, especially at the time that I was starting, was not getting the attention it deserved for the women and birthing people that I worked with. And so
Hmm.
I had told you years back when I did another talk for Gold that I became so frustrated that I went back to school. It wasn't that I didn't love what I was doing, but just the level of frustration that I reached led me to focus in perinatal psychiatry. So I became a psychiatric nurse practitioner and brought that into my work as a nurse midwife. And so then, as I learned more and more about suicide assessment and
Hmm.
the unfortunate, very, very common occurrence of suicidal thinking, and then the outcome, the most terrible outcome of suicide in the perinatal period. I just wanted to learn more. And then I've been privileged to sit on the New York City Department of Mental Health Maternal Mortality Committee. So I review these cases with a very large team, and I'll go into that in my talk.
Wow, that is very deep work, and I can imagine that that probably takes a lot out of you too. But I wanted to go back and ask you the statistic that you mentioned, and maybe this will help us, understand again, because I know that you probably have an answer to this question too, is, so we know that suicide and overdose are the leading causes. So that was our statistic, that you just mentioned. Yet the realities often remain so invisible. And that was something you and I had talked about earlier as well. So from your perspective, can you just share a little bit of, where, families and providers are most commonly falling through the cracks? I mean, I know you probably can't answer that in just a couple of minutes here, but is there something that's standing out for you as you're going through these cases?
Yes, one of the things that stands out to all of us on the committee, and the committee in New York City and across the country, and then in other countries, I'm learning as well that these types of committees exist and they may be designed differently, but that these losses are multifaceted.
Mm,
I mean, that sounds like common sense, but there's missed opportunities in many places in these mothers' lives, and very often the process that leads to the death starts many, many, many years before pregnancy. So
right.
it's typically there's health disparities. Trauma is something that we see in most of these mothers' lives, and we can see it in the notes that are collected through their healthcare throughout their lives. So it's very complex.
Sure.
The health disparities and the lack of access to mental health care, which is going to be the focus of my presentation, is really one of the key points.
Mm, yeah, it makes me think about how narrow-minded, I don't know if that's a nice thing to say, but how we zone in, in that period of perinatal health, and we don't really think about the big picture, the previous history, and then even long term. It's just so we're very acute focused, which is good sometimes in an emergent sort of situation. But as professionals, it seems like we really need to be less narrow-minded and thinking outside the box, thinking wider.
Yes, absolutely. And one of the things that comes up again and again in the United States, it's very prevalent, is the access to guns. So I will be bringing that up, is
Sure.
just being able to ask about guns and the availability of guns. And that's important for, of course, for children's health too. And then
Hmm.
as I don't think at all that midwives and other birth professionals all need to go back to school and be mental health professionals, but really to
Right.
understand that we have such key things that we can use. Just asking these really hard questions. And then intimate partner violence is another very huge topic that really ties into maternal deaths, unfortunately.
Yeah, absolutely. I want to shift gears a little bit now and talk about screening, because I think this is something that, we've started to see more and more frequently. A lot of healthcare professionals, perinatal professionals know about screening, and often it's emphasized. But what we've come to learn, it just alone isn't enough. So, what are some practical actions that midwives, nurses, frontline workers, whoever
Hmm.
is sort of in that period, even um, even when they're there, what can they access, in specialized mental health care is limited. So even when they have that there, what else can they do?
Yeah, absolutely. So before someone is asked to do the screening, I think it's really important that we as professionals have a level of comfort ourselves doing the
Right.
screening because the questions are very hard. And
Hmm.
our clients are very savvy. If they can tell that the person asking the questions is afraid of those questions for good reason, because
Right.
they're really hard questions to ask. And that's one place that I really want to start is helping staff who are giving these questions to feel
Mm,
comfortable and to know what to do with the information. Helping clients who are answering these questions feel safe and heard and know where the information is going and also
right.
in language that they feel comfortable with.
Yeah.
So not just in because the Edinburgh postnatal depression scale that we're all starting to use more and more, the language doesn't speak to everyone. So we
Right.
need to really think about the cultural context as well. And then, of course, if midwives and nurses are being asked to give this questionnaire, they need to know then where will these clients go? And if there is nowhere, then that's the first place before the screening even occurs. So there are national organizations that I'll touch on in my presentation as well that provide free resources. And then internationally as well, I'm going to encourage people to just really look for what are those resources because they are out there and many of them are run by peers. They're run by women and mothers and families, fathers who have gone through this and they want to help others after they've recovered.
Oof, I'm almost feeling an energy now that, folks who are listening right now, could start thinking about, if they could share one resource, what would it be? How would they
Mhm.
support, putting things together? Because I feel like, we're constantly lacking in this knowledge. I think we need to light the fire under people, literally,
Yes.
to sort of, know that this has not gone away. This is getting worse in a lot of areas. And we need to be very cognizant. But I loved what you said about the professional because when it comes to the screening factor, it's great that you can put that in front of a mother, a parent, but interpreting it and understanding it and then providing a follow-up to it is as equally important and
Yes.
valuable for that family. So I'm looking forward to hearing more about that from you as well. So yeah, that's going to be so good. All right, as I tie things together, and thank you again so much for your time today. But I wanted to mention again, so this is a heavy topic. I know this material is going to be heavy for some people. I know it could be triggering and activating of many
Mhm.
emotions. But yet so valuable as professionals, as we move forward. And I think every, clinician and educator, needs to come and listen to this. So can you tell me what is it that you most hope for that the participants going to carry with them and take away both professionally, and personally after this
Mhm.
session?
Yes. Well, I hope that everyone who's in the audience will feel empowered because I believe that everyone already has some of these skills to prevent these deaths from happening. And so I want them to leave knowing that they have that and what are these actionable steps that they can take and to know that they actually can make a huge difference because the vast majority of these deaths are preventable. And I think when we know that, it can feel like less of a hopeless topic because we really can impact these tragic numbers. And I also want all of us who are working in this area to have tools to take care of ourselves
Mm.
because, as you said, it is just so hard and so heartbreaking. So I want to bring some of that to the audience as well.
Wow. Well, thank you so much. And, thank you for just the little time that we've had together today. Again, my thinking and thoughts, again, I recognize what I need to do further in my learning and my skill set. So thank you for that. But I know that you're actually going to be here with us, of course, for the whole presentation. And that is going to be a delight to have you, as well as, of course, you'll have an opportunity we'll do a live Q&A with our audience as well and try and answer some of those questions of what it looks like in the real world. I know you're going to be presenting some case studies as well to help us kind of walk through, in a real case scenario as well. So thank you so much, Rebecca. It's been lovely chatting with you today.
Thank you.
And I will look forward to having you back, of course, very soon. Head over to the website. As I mentioned, lots of details on there. You can check out some of Rebecca's work over there. When care isn't there, lack of access to mental health services is costing mothers' lives. Designed by Rebecca Feldman, but so many mothers around the world want you to hear this, I know, as we move forward, because it's their stories that I know that you share through your presenting as well. Thank you again for listening here today. And thank you to Rebecca. We'll look forward to seeing you all very soon. Bye-bye for now.